Hey everyone out there, it's Roberto Miki again, and we've got another question of the week. It's number 20 in our series of questions for medical students, residents, and fellows studying for the boards or in training exams. Well, without any further delay, here's our question. A patient with a distal radius fracture presents with the physical findings seen in the video. What explains the findings? A. Posterior interosseous nerve palsy. B. Contracture of the interphalangeal joint. C. Acute carpal tunnel syndrome. D. Rupture of the extensor pollicis longus tendon. Or E. Complex regional pain syndrome.
Is try to lift your thumb up. Okay. Try to lift your thumb up. Good. And try to lift your thumb up again. She cannot do it. She had a wrist fracture.
Well, here's your chance to pause the video so you can answer the question. The patient has an inability to extend the thumb interphalangeal joint after a distal radius fracture, which was treated closed in a cast. A posterior interosseous nerve palsy could explain the lack of extension, but other fingers would have lost extension as well, so this is excluded. Contracture of the interphalangeal joint would be unlikely in this scenario, and carpal tunnel syndrome and CRPS would be unlikely to lead to loss of thumb extension. The most plausible explanation is the rupture of the extensor pollicis longus tendon. Remember, in a patient who has a distal radius fracture which is treated closed, the most common complication involving the tendons is a rupture of the extensor pollicis longus tendon. So the answer is D, rupture of the extensor pollicis longus tendon. Thanks for watching. I hope you learned something, and we'll see you in the next one. Remember to subscribe and like so you can help to support this channel. Have a good night.